Welcome, everyone. My name is Dr. Sophia Tolliver. I am a clinical assistant professor here in the Department of Family Medicine at The Ohio State University Wexner Medical Center. That's a mouthful. I am also the vice chair for wellness in the department, and I am co-advisor of the Family Medicine Interest Group. So I just want to say thank you for coming to today's webinar. We are going to talk about 5 appointments to make every year. And this webinar is actually based off of a hospital blog post that we did outlining similar content. And we thought we'd bring it to a larger sort of audience, flesh out some of the points a little bit more, and give you fine folks an opportunity to ask questions. So let's get started here. Who am I? I am a Buckeye lifer through and through. I have 4 separate degrees from the Ohio State University. I'm very proud of that. My sisters all went to Ohio State. In addition to being a professor in my department, some of the other things I already kind of talked about here, I am pretty committed to Ohio State as far as it goes educationally and professionally at this point. So go Bucks. Okay, without further ado, let's talk about the 5 top appointments every man should make during the year. And we're going to go through them really in no particular order. But I think I did include probably the first one that I think is probably most important first, just because there are a lot of parts and pieces to it. So number 1, annual physical, okay? The annual physical is really an opportunity for you and your doctor to get together and talk about health prevention. Obviously, you can sneak in other things, diabetes, hypertension, whatnot in there, but really this is an opportunity to talk about health prevention, things that you can do in your everyday life to prevent chronic disease, prevent sustained illness, and really focus on healthy habits to make sure that you are living your absolute best life and the longest life that you can. Okay, so in an annual physical, there's an opportunity to check your vitals. We'll kind of go through that, parts and pieces of that. Obviously talk about health prevention, disease prevention, so health promotion, disease prevention, your health screenings that are very important for you to get done on interval basis, regular basis. And also just estimate your individual risk for certain conditions based on your family history, based on your lifestyle. So it's a very, very important appointment to make on an annual basis, not once every 3 years, not once every decade, but really annual is going to give us the best opportunity to track how you are doing. Okay, so let's talk about vitals. So you come to your doctors, you check in, you're sitting in the waiting area. Finally, that medical assistant or nurse comes out to get you. First place they take you to the scale, or maybe they take you to get your blood pressure done, or maybe they, right next to the scale is usually an opportunity to measure how tall you are. And really, these are sort of the initial things that we do at an annual physical to set the tone, right? So if we have you come in and your blood pressure is elevated, this is going to tell me we need to have a further discussion about what things could be causing your blood pressure to be elevated. Maybe stress, maybe you forgot to take your medications, but this is a way for us to every year, at least once a year, screen you for blood pressure issues so that we can treat you, make some suggestions so that your blood pressure is in the normal range. We get very concerned about high blood pressure because it's known as the silent killer. A lot of people say, oh, well, I feel fine. I don't need to check my blood pressure. I'm doing great. But blood pressure, again, we call this silent killer because you'll be walking along singing a song and all of a sudden, for many people, bam, it's a stroke. Bam, it's a heart attack. And so you and your doctor in this wonderful setting of an annual physical can begin to address that right off the bat. Pulse and heart rate. If you come in and your normal pulse is anywhere between 70 to 100, if your pulse is in the 50s, 40s, or if your pulse is in the one teens, 120s, 130s, we're going to look into that a little bit further. Okay. Maybe you're dehydrated. Maybe you cut yourself a week ago on your foot and it's healing, but it's red and it's pussing and it doesn't smell right. We might be concerned about a lot of different conditions just based upon your pulse and your heart rate. Is your pulse irregular, right? Atrial fibrillation, irregular heartbeat that can increase your risk for a stroke down the line. We can find that information just by assessing your pulse. Temperature. Normal temperature, average temperature, meaning some people will be a little bit higher, some people will be a little bit lower, is 98.6 degrees. If you come in and your temperature is 102, we're going to look a little bit further into that. That's not normal. That's not a normal temperature. And then obviously height and weight. And if you do a little calculation called BMI, which stands for body mass index, that will begin to give us a sort of indicator of where along the spectrum of weight you might fall. Now, I always tell my patients, I don't want you to get hung up on this label that's associated with the BMI. And it goes from underweight to normal weight, to overweight, to obese, morbidly obese, so on and so forth. Whatever number your BMI or range your BMI falls into, I don't want you to get caught up on that number, but we do need to have a conversation as it applies to you about diet and exercise, about potentially decreasing sugars in the diet, increasing fiber, and good healthy fruits and vegetables in the diet. So, height and weight together can give us some information that will further kind of guide our conversation. So we're tailoring this entire annual physical exam to your needs. It's not a cookie cutter examination or discussion, and it really is all about you, the patient. Okay, so again, within the confines of the annual physical, health prevention discussion. This is probably my most favorite part of being a family medicine primary care doctor, is talking to people about good health. It's not something that is high in the sky, unattainable. We all can reach good health every day, one decision at a time, right? So often people try to layer on so many different things that they're doing in the day, and then they get bogged down and then they crash. And I really, really try to encourage my patients, pick one thing that means a lot to you. One thing that in terms of a goal is going to help you accomplish that goal day after day, whether that's increasing your water intake or saying no to that last dessert of the day, or even just getting up at a certain time during the day to get your day started. Pick one thing that's going to help you be healthy for that day. And then when we become successful, we can begin to layer upon that. So let's talk about in this special visit, this annual physical, we get a great opportunity to talk about so many different things. And I just listed 5 here, but anxiety and depression, okay, mood disorders, maybe, obviously with the pandemic, we're all feeling the burn, right? We're all feeling sort of the stress and the fatigue of having to deal with pandemic lifestyle day after day. And for some people, we're able to kind of brush it off, reset our day, but for others, it's starting to take a toll. It's starting to really, really not put us in a good position mentally. And that's okay. And in your annual physical, and even I would say outside of your annual physical, anytime that you feel like you can call the office, schedule an appointment, or now in the days of pandemic, you can actually send me a message. You can send me an email and we can follow up that way, and we can get you scheduled and on my on my schedule so that we can talk about this further. But I get to talk to you about anxiety and depression. I get to screen you to see how bad it might be, how severe your symptoms might be. Do we need to maybe refer you to counseling, to talk to someone? Counseling does wonders for some of these levels of anxiety and depression. Or, this is an opportunity where we can make a very shared decision about, do we need to start different medication? Or do we need to maybe think about increasing our physical activity? Because sometimes that can be helpful as well to boost our mood. Sleep hygiene, sleep apnea. I always ask my patients in this visit, how are you sleeping? Do you wake up restless? Do you wake up restful? Do you snore at night? Do you wake up gasping for air? Do you usually feel tired or fatigued during the day? Do you take naps during the day? If you answer yes to all of those questions, I'm going to encourage you to go talk to your doctor, because good sleep is paramount and important in the foundation, I believe, of really setting a good tone to your day. And if you don't have good sleep, it's really hard to process different things that are coming at you during the day, the different stressors, things that you have to do. So I get to talk to people about sleep, and we get to find a plan of action so that you can obtain good sleep. And we want to screen you for sleep apnea and make sure that, this is not affecting you, because down the road, and we go back and we talk about disease prevention, us having a conversation about your sleep and your sleep health and the potential of you having sleep apnea can save you that disease, that condition progressing, because sleep apnea can actually increase your risk for heart attack, stroke, anxiety, all kinds of things. So let's nip it in the bud here, so you don't even have to deal with that, right? Sexual health. This is a very, important conversation, one that, some men might shy away from, but I encourage you to find a doctor that you can become comfortable with, a doctor that you can trust, so that you can broach this very important topic. We're going to ask you about, sexual activity. We're going to ask you about sexual frequency. We're going to ask you about your concern about any STDs, any sexually transmitted diseases you've had in the past. This is a good opportunity to ask questions about prostate health. Are you getting up in the middle of the night, 10 times to go to the bathroom? That might be something more serious. So erectile dysfunction, a lot of these issues that we talk about are connected to other issues. So if you're having erectile dysfunction, I might want to ask you about, your family history, any history of heart attack and stroke, any cardiovascular disease. So they're all connected, and this is definitely an important topic to talk about. Smoking, alcohol, drugs. There's so many ways that people are smoking things nowadays. It's hard to keep track, right? But the most obvious being tobacco, cigarettes, right? We're gonna ask you about that. I always tell my patients, tobacco, smoking cigarettes, smoking wants to kill every cell in your body, right? Smoking causes cancer. We know that. That's not new. How can we, in a very non-judgmental setting, talk about opportunities for cessation or quitting smoking? Have you ever tried to quit smoking? Okay, if you've tried to quit smoking in the past, what have you tried? Sometimes, patients have only tried one or two things, right? When the average smoker is going to take 7 to 12 times before they're successful with smoking cessation. So if you've only tried one or two things, we have a whole cadre, a whole arsenal of things that we can try. So digging a little bit deeper into the smoking history, alcohol as well. Well, some patients will say, well, I have some wine with dinner. Well, what's some wine? Is it one glass of wine, maybe 4 to 5 ounces, or is it the whole bottle? Your risk for certain conditions and diseases increases based on your consumption. And so we want to find that out. We want to be very proactive about, maybe not saying, hey, stop, especially if you're adamant about having that wine with dinner, but at the very least, letting you know what the risks associated with excessive alcohol consumption are, okay? Drugs, obviously, you know, drugs are just not good, right? There are a lot of different drugs out there. We'll ask you about them. We're in Ohio. We were at one point ground zero for the opioid epidemic. So we want to ask you about certain habits so we have the full picture and we can treat you appropriately, or at least give you the correct information as you are engaging in some of these activities. Okay, the last one here, vaccinations and blood works. I'm of the belief, I'm a family medicine doctor, vaccinations save lives. You know, it's sort of a first world issue when we can look around and we don't see polio, we don't see smallpox, because vaccines have been developed to help eradicate these diseases. And so we kind of lose, you know, that thought of, wow, I don't see it, so it's not important to me, so you know, I don't have to focus on vaccines. But vaccinations actually help save lives. They've eradicated many diseases and continue to help prevent diseases from arising. So we're going to talk to you about the vaccinations that we believe you to be ready for, appropriate for, based on your medical history. Vaccinations, you know, depending on different medical conditions, aren't appropriate for everyone. And there are many different types of vaccines. Obviously, more recently in the pandemic, we're dealing with the COVID vaccine. I encourage everyone out there to have a conversation with your primary care doctor about the COVID vaccine, even if you're completely against it. Give your doctor the opportunity to engage with you in a conversation about vaccination and ask all of the questions that you feel are important to you and your family. Okay, I'm recommending the COVID-19 vaccination for my patients. And I've had many conversations with my patients. Some are adamant against it. Some are, you know, ready to have it yesterday. But they all get a chance to talk with me about what their concerns are. And I think at the heart of being a family medicine doctor, being able to talk with your doctor about prevention and safety and benefits and risks is sort of the heart of our relationship. So I really do appreciate all of the conversations that we've had around it. And then obviously blood work, you know, based on what you tell me as my patient, I might say, you're tired and lightheaded all the time and you feel like you're passing out. Maybe we need to check this level, or you know, for whatever reason, and whatever conditions our patients are coming from into the clinic office. There are so many different labs that we might suggest getting checked. So this is an opportunity for us to really, you know, take a look inside in the blood and see what's going on. So that's also another conversation you can have with your doctor. Not, you know, just, oh, let's get blood work, but here's the blood work that I'd like to get, and here's why. And if we see X, Y, and Z, then we can do the next step. So all of the annual physical is really about a conversation. Okay, another thing we get to do in the visit is discuss your individual risk. And I only put a couple examples on here, but if you come to me and we're doing your annual physical and you are appropriate for, you know, cholesterol screening, meaning we're going to check the different levels of your cholesterol, your triglycerides, your good cholesterol, your bad cholesterol, your different ratios, all just, you know, from giving me a little bit of blood to analyze, or the lab to analyze. We're going to be able to calculate something called your ASCVD risk score, which stands for atherosclerotic cardiovascular disease risk score. And this is your 10-year risk score of a heart attack or stroke, okay? And based on certain percentages across a range, we might say, you know, you're doing great, carry on, love your lifestyle habits, you're doing well in terms of diet, exercise, and what have you. We'll say, or we'll say, you are in the gray area between normal and concerning. We'll, you know, have a conversation about your medical history, your, you know, was there any heart attacks or strokes in your family? what's kind of going on in your life stress-wise? Do we have an opportunity to monitor, or would it be better for us to consider maybe a medication? And then, if you're past those ranges into the concerning range, where we say, you are an excellent candidate for a cholesterol lowering medication called a statin, this will be the time for us to really talk about that. And this conversation a lot of times we have before we've even drawn any blood, so that you understand why we're drawing blood, why we would be concerned, what we would do with the results, and how to move forward. Okay. Also, something else that we can kind of assess is your diabetes risk. We have normal blood sugars. There's a range called pre-diabetes. And then obviously, if you're over a certain threshold, you could be diagnosed with diabetes, right? And so if you come in and, we take blood and you're in that sort of middle range, we're going to have a conversation, right, about diet and exercise. And hopefully we have already had, the beginnings of that conversation in the annual physical. But after we get that blood work and, that confirmation that we need to maybe discuss a little bit further, we'll talk about resources that are available to you. For example, if you are pre-diabetic or now you are over the diabetes threshold, let's talk about seeing a nutritionist or a dietitianist. Let's talk about your diet. Let's get into maybe a food log and see where we might be having some room for growth or opportunity to change. And I think there's always an opportunity to change. Obviously, if you're very sick or on the verge of something serious happening, we can send you where we need to send you, the emergency room, or get you medications right away. But for a lot of my patients, there's an opportunity to understand the results and try to implement some lifestyle changes to prevent progression of high blood sugars, which could lead to diabetes, right? And I always want to try to give my patients that opportunity, because sometimes you just don't know. You don't know that you don't know. And coming to a doctor, figuring out what might be going right and what might not be going right is really a great opportunity in the annual physical. Okay, health screenings discussion. I love talking about this too. I think I get excited when we talk about this, because this is really where the prevention comes in. So colonoscopy. Raise your hand if you've gotten your colonoscopy. Okay, if you are, and I'll put a little caveat to this, but 50 and older, thank you, Stuart. 50 and older, you are eligible, obviously, in a discussion with your doctor, making sure that you're appropriate. 50 and older, we are recommending that you get your colonoscopy. Colonoscopy is a scope into the colon in efforts to look for things that might be going on inside your colon. Masses, discolorations, things that just aren't right. And we usually do this every 10 years. If you get a colonoscopy and your doctor finds maybe a little lump or bump or mass, you are recommended to get that screening more frequently. But colonoscopy helps to prevent colon cancer by being able to look in the colon, find if there's an early precancerous lesion, taking it out at the time of the colonoscopy, and then monitoring you until your next colonoscopy. Great way to decrease your risk of colon cancer. PSA stands for prostate specific antigen screening. This is more of a controversial lab that we sort of discuss with our patients, because it's not necessarily always appropriate for everyone. It really is about you sitting down with your doctor and having a discussion about your family history, any current symptoms, to make sure that you're appropriate for this. Because with this specific lab, just because it comes back and it's elevated, it doesn't necessarily mean that you have something wrong or something that might be cancer. But just because it comes back normal or, not concerning doesn't mean that you don't. So you really, really have to sit down with your doctor to figure out if this test is a test that's appropriate for you, right? Next on the list, CT lung cancer screening. This one is for my patients who smoke and have smoked such to where they've smoked so much that they're reaching a certain threshold to where they would be appropriate for this imaging study. And this CT lung cancer screening is a low dose CT scan that is done annually. And the point of this imaging study is to look for early signs of lung cancer so that they can be found and treated, and so that, you know, if they find a small lesion on one CT scan, they can monitor it to see if it stays the same size or if it grows. Okay, so this is another weapon we have in our arsenal of prevention that is really meant to help patients live a great long life. And then abdominal aortic aneurysm ultrasound screening. Again, if you have a history of smoking, your doctor might recommend this as well. An aneurysm being sort of a ballooning of the vessel, a weakening of the wall of the vessel, that if not caught could lead to really dire outcomes. So all of these things we get to talk about. Okay, number 2. So that was annual physical exam, and I hope you were able to sense how important I think this is. But next thing, dental exam. Oral health is super important. It can be sort of a gateway into the soul. It can tell us about maybe your quality of life, your access to, you know, running water or toothbrushes or different things of that nature. It's linked with, you know, heart disease, cancer, diabetes. Making sure that you're getting your teeth cleaning every 6 months, super important. A lot of people don't like going to the dental exam, and it's very understandable. But find a dentist that you like and one that can kind of take it at your speed, right? If they say, oh, I want to take out all your teeth and do this and that, say, no, let's start slow. Help me understand what you're doing and we can move forward, okay? But make sure you're getting your dental exams. Vision screening. I wear glasses and contacts, but you don't have to wear glasses and contacts to go to get an annual vision screening, because sometimes even those people with perfect vision, they can find things in your eyes that can tell them about different disease processes that might be going on in your body. And they can find any early signs of vision problems while you're there. So even if you don't wear glasses or contacts, make sure you're getting to the optometrist or the ophthalmologist for your vision screen, okay? Mental health counseling, super, super important. There's a stigma around mental health counseling and going to see a doctor to talk about mental health, going to see a counselor, a therapist. I say use this as an opportunity for a tune-up. Let it be preventative, not merely reactive. Don't wait till there's something already wrong and you don't know how to figure it out. Really try and make an appointment once a year, you know, maybe preferably around your birthday, a chance for you to just go in and talk with someone. Maybe there's nothing on your mind, but allow that person maybe, you know, challenge you and how you're perceiving the world, how you're processing the world, to really give you that confidence that you're on the right track. And then sometimes things come up that you're not even aware of during these conversations. And there have been some real breakthroughs with these conversations. So they can teach you how to, you know, teach you coping skills and how to sort of build up your mental repertoire for handling different stressors in life. So I definitely recommend talking with a therapist or a counselor once a year. And there's so many different ways to do it now. You can do it in the comfort of your own home, at your computer, through these different health apps. So it's very accessible these days. Okay, last one is financial counseling. Money, money, money is the source of lots of stress and anxiety, and we don't even know it. And, you know, oftentimes we're not able to change our sort of financial situation in a quick sort of way, but we can begin to learn about money and finances and how they affect our stress and our health. And the more you know about your finances, what you can do and what you can't do, that might actually help to decrease your stress related to your finances, until you're able to do more, or maybe you are content with where you are. So focusing on a budget, goal setting, it's not diabetes and hypertension, but it's just as important, and it can do a lot to decrease the stress in your life. So try to look out for sources online, as it relates to budgeting and financial counseling, or if you're able, seek out these individuals who can help you set up a budget. But getting stress related to finances down can really translate into better health across the board. Okay, so to summarize, annual physical, dental exam, vision screening, mental health counseling, and financial counseling. These are my 5 top appointments I think every man should seek out every year. I'm Dr. Sophia Tolliver. If there are any questions, she's going to read them from the chat if we have time. And if you need a doctor, call this number, 614-293-3200. They can point you to the right area, to the right direction for a referral to a doctor, or you can go to wexnermedical.osu.edu/find-a-doctor, and you can look for a doctor in your area.